further ado, we're just going to move straight on. We've got Dr. Craig Dick, who's the Medical Director at Axon Diagnostics, speaking next. Really, really pleased to have the team involved again. Hi, Craig, how are you?
Hello, I'm on
Craig.
Can you hear me now?
I can hear you now, absolutely perfect.
Excellent, yeah, I'm good. How are you?
Not so bad at all. Yeah, we're, well, thank you very much.
Good.
Indeed. Are you going to share your slides for us, Craig? I believe on your
I'll share my slides, yeah. Shall we get going?
Brilliant. Yeah, I'll give you a nod when we can see them. That'd be great. Perfect, Craig. Just need to get those in full screen mode. There we go. So we've got 3 for 3 now. I can hear you. We see you've got your slides. So, Craig, I will see you afterwards for some Q&A. Thank you again.
Excellent. Thank you very much. I'm Craig Dick. I'm the Medical Director at Axon Diagnostics. I've got an experience in IT and clinical governance in multiple countries around the world. I'm particularly interested in change management, and I'm a Six Sigma Master Black Belt. So we're just going to have a little chat today about networking, security, and diagnostics really in the near future. If this will change pages. There we go. So we've all heard the long-term plan for diagnostics and imaging networks across England by 2023, and then the plans to sort of make them a little bit smaller. And we all want really to get better access to imaging for all our patients, a better sustainable service in the NHS, better staff, more staff. There's lots of talk about efficiency and economy of scale. The NHS is one of the biggest employers in the world, you know, bigger than Amazon overall. And as radiologists, we want better sharing of images, and diagnosticians, just pathologists and everyone else. So especially over the pandemic that as we've heard, we need better communication of imaging, better home reporting, better networks, and more security. But why do we need these networks? Well, we've talked about networks today, and of course, networks are not just IT systems; they're a grouping of hospitals and areas of the NHS, and these are the usual buzzwords for networks for diffusion of information, so communication across all the trusts, the reach, which is very important now. So there's no geographical boundaries to anyone having any imaging done or reporting. More importantly, scalability. The system needs to move and enlarge as the number of patients coming through the system has to be able to cope with that. Also, resilience to any problems with it, fluctuations in hospital equipment and staffing, and again, adaptive capacity. Some hospitals may engage with different networks. And one of the other issues that was just pointed out by my previous colleague, just configuration inefficiencies, lots of disjointed systems, risk packs. Although a lot of these systems are supposed to be vendor neutral, they're not vendor neutral, and it's difficult to communicate across sites and networks. And overall, we'll get improved quality assurance. So the statement from the NHS was that with this rising activity in diagnostics, funding is not sustainable, either financially or in terms of delivering the service itself. So the NHS wants to improve access to diagnostics through the networks, standardize the pathways and protocols and the treatment pathways of patients, and then get some efficiency and cost savings. So if we have a little look at the overall network systems using some Six Sigma, we can fishbone out what diagnostics is. This is a bit of a simplified diagram for diagnostics overall, but gives some of the main points that we need to be looking at: equipment, staffing, procedures, i.e. demand and pathways, and getting these done. So as we all know right now, if we dig a little bit deeper in, especially looking at equipment, the equipment in the NHS is limited, it's old, it needs replacing. But not only does the equipment need replacing, they're out-of-date diagnostics. So the imaging quality is a lot less. The new techniques and patient care is reduced just by having old equipment. And this creates a big cost and a big impact on patient care overall. Staffing, we don't have enough diagnostic staff. We all know this. We all feel the pressure We know about insourcing, outsourcing, and having to use locums that we can't even fill. The staff that we have feel undervalued, and there's loads of people coming into retirement. On the procedure side, differing pathways between differing trusts. It would be great to sort of unify the patient care pathways, and progressively increasing demand for patients, 10% year on year in imaging alone. So this creates this typical diagnostic funnel, increasing demand for patients, equipment shortage, staff shortage, which is a wait for any imaging and any diagnostic results and reports coming out. And all that happens is a delay in patient care and treatment, and this costs even more money year on year. So it's great that the NHS has now said that they need more money for equipment, and the networking is great because there's more money coming in, and this should help as well. Weaknesses, again, limited old equipment, staff shortage, and a finite national IT structure. And the opportunities in this case are the investment in people, equipment, and technology. And the drawbacks, again, the delay in patient care and increase in costs, just as some people quite like the SWOT diagram. So what can we do with future solutions? Well, Six Sigma says define, measure, analyze, improve, and control. So what you have to do is you have to remove the funnel net. We need to buy more equipment first and foremost, and staff that equipment. Then plan for the scalability and resilience of that, integrate the IT network, and get efficiency and quality improvement in there as well. Of course, getting equipment and starting down that route takes quite a long time. So what we did is had a little look at diagnostic IT networks and security and what we could do to improve these. So on the left side is more what we're looking at as a user fast access and connection, a reliable system you want to be able to get on when you need to get on, scalable. So the more work you do or any changes that you need, that can be done. And it also needs to be lossless. One thing that's important in pathology and radiology diagnostics is that images have to be 100% lossless. And some technologies do not transmit lossless images, which is a risk to the patient. So on the security side, they need to be, network side, they need to be secure. The IT people need to be able to scan easily for vulnerabilities, be able to find attacks and stop them. And the management of the system itself needs to be easy. And you can't lose any data, obviously, with GDPR regulations. You know, nobody wants their data out there. So we're just going to do a quick little poll just to see what people think about hospital network systems, to see if the network poles are secure. I can't see a result on there. Okay, we haven't got a poll, but we can look at it at the end. The next one is, if somebody wants to have a little poll, we'll do the poll. Then if I can't quite see it, is VPN secure? So just before we start off on a little bit further on that side, we'll have a little look at data breach costs. I've done quite a bit of work in the US, so I use US numbers. They're a little bit more striking. But last year, data breach costs in the US were over $13 billion US. Each individual hospital breach cost was over $9 million US. 60% of these were all from external attacks, and almost all of these were VPN related. For most hospitals and data structures are using VPN systems right now. So our options, there are a multitude of different options to access your data. VPN, VDI, Zero Trust, SDP. So I concentrated on these top four, really. I like to use this concept of data in motion for security. If data isn't moved anywhere, it can't be copied anywhere. So if you can't physically move the data, nobody can do anything with it. They can maybe take a picture of it, or, but that's about it. If you stop the movement, you stop the breach of data. So this is one of the things we had to look at. So at Axon, we had a little look at how we could solve some of these efficiency problems and security issues. So VPN, been around a long, long time. It's old technology. It's an encrypted tunneled line, which is open at the front end, open at the back end. And it's an open tunnel. Once the tunnel's open, it's free access through this tunnel. Very difficult to manage. The IT team can't keep an eye on what you're doing at the top end. At the bottom end, they allow access everywhere, so it's very difficult. Once a problem happens, they have real trouble finding out where the problem is. And the most important problem from diagnostics is you can't handle a huge amount of people running through the VPN line, especially if we're moving to flexible working these days with lots of people using VPN lines. The NHS, again, one of the biggest employers in the world, can't handle, VPN lines cannot handle the number of users and the data running through this. We've all had experience of this. I've done loads of teleradiology, sitting around 45 minutes for a scan to report because you can't get the data through the encrypted line fast enough because it's a VPN. So then we did some work with the Axon lossless VDI. One of the great things about this, minimal hardware, you can use old equipment to get into it. You know, even on the ward, old 20-year-old PCs can access VDI. There's restricted data movement. The data doesn't actually leave the secure network. Centralized management, which is easy to control. It's a fast resource, lossless, easy to deploy, fast. Servers are a little bit expensive at the moment, and you need good experienced IT staff to run it. Zero trust access. This one really doesn't trust anybody anywhere, which is the sort of I'm scared of everybody attack approach. It becomes more and more restrictive as you use it. The employees feel that they're being watched and monitored all the time. They have to continually request access to differing areas, or even if it's a small different area that can't use the internet at the same time. It really reduces productivity because it also backhauls the application traffic, similar to what VPN does. SDP, this is a software-defined perimeter, which is good for segmentation and encryption, and gives a good individual personalized network connection. It's good for IT management. But the problem is it's a least access baseline. It's again a reduced trust system. Restriction tends to be done as automated, with new access requiring IT input, which is usually designed to be very minimal because it wants to be a cost-saving system. It tends to be lossy, and data is again transferred outside of the system. So we had a little look at what we could do from this point of view and what we wanted out of the system. We wanted, you know, a fast login time, good reporting efficiency, lossless imaging, and ease of use, and really a satisfied user at the end, really radiologist, pathologist, reporting radiographer. So we had a look through all these systems and looked at login times. This is from logging into putting your password into the PC to getting a login screen up with a patient data image. This was both pathology and radiology, able to report and scroll through the images. And the Axon VDI came in at 52 seconds on average. Some of the other systems, looking at some of the national systems, 25 minutes was one of the longest times for logging in, which was quite a waste of time in the mornings. Reporting efficiency, so we looked at overall workflow through the list, did this multiple times through multiple sessions with just a standard variation of images with cancer imaging, pathology slides, and overall with the VDI solution, that came out at 22% more efficient overall in a reporting day. We did it per session. So we looked at lossless imaging, did some independent verification, also using the Royal College, and VDI came out 100% lossless, which is exactly what you want for any diagnostic imaging study. Now VPN through a tunnel line is again a lossless, or should be lossless imaging. Some VPN setups do compress the data, but for medical work, this should all be lossless. But again, significant delay because you have to physically move that data outside of the network. As soon as you move it out, it's at risk of being stolen, it's at risk of being hacked, and you're at risk of getting into the system. So we looked at job satisfaction using the employee satisfaction index, and VDI came out at 95% compared to VPN at only 25%. So really VDI was really the solution here. It solves all the real issues of remote access versus SDP and 0-point. VPN I didn't put on the podium because it's such a poor old system that really should be chucked out the window these days. So just in numbers for the efficiency in reporting through, this is a typical 8-hour day, a 2-session list. We calculated it was over an hour and 23 minutes time saving. And that was just due to the fast login, easy access to the diagnostics, fast access to all the imaging, because it's not being downloaded and transferred back and forth. And obviously, this has significantly improved efficiency overall. So, you know, what we want in the NHS is we want them to invest in the staffing, the equipment. Obviously, we need more staff, the equipment to get the patients through. We need to optimize the IT networks as we're all trying to do. But one thing we should probably really think about is getting rid of VPN networks. We know that there's been multiple UK cases and Ireland recently, big payouts for hospital IT systems that have been breached. But you also have to have easy access. You have to make it good for the patients to access their material, but more importantly for the diagnosticians and clinicians, whether it be radiologists, pathologists, or even oncologists, or other people that need the images to get them securely wherever they are. And again, this will all give us efficiency and overall save the NHS a lot of money. That's it. You there, Sean?
Can you hear me okay?
Yep.
Absolutely brilliant. Thank you for the presentation. Just going to open up to questions for about 3 to 4 minutes. That's okay. We have got one coming through as well. I'm just going to run a quick poll as well on the screen. And we're just going to start off with this quick question here. So what separates Axon from other outsourced providers, Craig?
So we've developed this BDI solution, which again doesn't move data outside of the HSCN network. So wherever the hospital, almost all the hospitals are connected to HSCN, which is in itself a secure loop. So we transfer the work into the HSCN network, and then data never leaves that. It's streamed almost like Netflix. So it's very secure. The other thing is, because it's so fast and efficient, and because of the technology using the VDI and the way our servers and structure is set out, our costs are a lot lower. So one of the things that we wanted to do from the start is significantly reduce the cost to the NHS and make the cost savings for all this large amount of outsourcing work happen. But also we're all set up with clinical governance and our pathways to promote insourcing. And that's our number one aim, is to get the network set up and help with this system to promote insourcing. And again, that's even cheaper to supply and help the NHS with.
Absolutely perfect. Thank you, Craig. What we'll do, shall we share these poll results as well?
Yeah.
Craig as well. So I'll just get the team to share the first poll results as well, and we can get Craig to assess that and see what he thinks. That'd be great. Right, so there you go, Craig, on your screen now.
Oh, I've still got mine. Do I have to come off my?
Oh, no worries, it's fine. So are all hospital networks secure?
Oh, there we go.
Yeah, you can see that, Craig.
Yeah, okay, that's interesting. Yeah, 36% say all hospital networks are secure. So, you know, again, after having a chat, you know, as soon as you have an entry point into a hospital network, then by definition, it can't be secure. So if any data moves outside of that network, then you're at risk from an entry point and attack. And this is mainly the problem with VPN lines, really, is running outside of the HSCN network. And then you're vulnerable to attack, and it grinds your hospital to a halt and costs a significant amount of money. Also, it's not efficient. So, interesting.
Backs up what you were saying a little bit earlier on with the VPN. So on the screen now is the second poll results, Craig.
Yeah. Okay. Yeah. VPN. Yeah. That's the usual misconception that VPN is a very secure environment to work in. And all you need to do, people say it's almost impossible to run into an encrypted VPN line, but it's not impossible actually. But more importantly, it's the front and top end of the tunnels that are completely open. All you have to do is open one email on your server, on your laptop at home or anything. An email from an email from an email from a friend, and that's it. Somebody's in the system instantly. Whereas if you use 0 point is too restricted, but if you use something like VDI, they can't get in because they're coming in through you're actually viewing the data from inside the HSCN. The data's not actually coming out.
Actually, yeah.
So you can control, you can control all of that from within the HSCN and stop any attack points from inside.
Very, very, very impressive stuff. So I'd encourage everyone who got involved in the surveys to reach out to Craig and the team. You can do that via the handouts PDF document provided, but I've learned something there, Craig, as well. I thought VPNs were completely safe and secure, so really appreciate that, and really good conversation started there. So Craig, absolute pleasure to have you involved. Really appreciate the support. Are we okay to get the slide shared after the conference? We have been asked for that multiple times as well.
Yep, absolutely.
Brilliant. Craig, you're a star. Thank you so much for joining us. Brilliant.
Cheers.
Cheers, Craig.
Cheers. Bye-bye.
Right, everybody, just to give you a quick FYI, we are going to factor in a quick comfort break in a little while, probably about 5